Come in.
Hi Lacey, how are you today?
Fine, how are you?
I'm Eric and I'm going to be getting a set of vitals on you today if that's alright.
Sure.
Alright, I'm going to sit down here so we're not so far apart. And let me sanitize my hands real quick and put some gloves on. Now, have you had any nicotine or caffeine in the past 30 minutes?
No.
No? Any strenuous exercise or exercise, anything that would raise up your heart rate?
No.
In the past 5 to 15 minutes, nothing like that? Okay, feeling pretty calm?
Sure.
Okay, great. Alright, those things, you gotta ask that because they can give us inaccurate results. Alright, so we're gonna start off today. I'm gonna get your temperature. Is that alright?
Mm-hmm.
Okay, we're gonna use oral thermometer here. It's really accurate as long as you haven't had anything real hot or cold or really anything to drink in the past 30 minutes or so. That can throw off the results. Nothing like that? Okay. Any mouth sores, oral surgery, any reason I shouldn't be sticking this thermometer in your mouth? No, nothing like that. Alright, obviously don't bite down on it. Keep it under your tongue. Typically that's a problem with younger kids. We might not use the oral thermometer in that case. They have to be able to, you have to be able to keep your mouth closed and not bite it. Alright? Alright, so I'm going to put the probe cover on here. And I'll stick it under your tongue. You close your mouth, and when it beeps, I'll take it out. Okay. All right. Here we go. All right. This thing takes forever to read. Beep, beep, beep. Okay, Lace, I'm going to take it out. All right. Your temperature is 98.2, so that's normal. Let me write your temperature down here. 98.2. Okay, so like I said, that's a great way to take temp. You wouldn't want to do it obviously if they've ate or drank or anything real hot or cold in the past 30 minutes or so. Mouth surgery, like I said, sore or pain, you wouldn't want to stick it in there. Younger children, usually under 5, you don't want to do that. They have to be able to keep the mouth closed, not bite it. Some other good ways to take a temperature would be axillary, that's under the armpit. It's really good for all age ranges. Children can tolerate it. It's not quite as accurate as other methods. Typically, it's a little bit lower, but it's still certainly accurate, and it's a good way to do it. Make sure that they haven't had like an ice pack, in this area where the armpit is, or a hot pack, or if they're sweating excessively, you're going to want to wipe that out. But it's a good way to do it. Another few other forms of temperature would be rectal, which obviously not going to happen very often. You might use that if you need a more precise core body temperature. Typically, they do that the first temperature after a baby is born, to get that core temperature and make sure there's no obstructions there. Another reason you might do a rectal would be hypo or hyperthermia, seizure activity, and unconsciousness. The doctor may specifically order a rectal for various reasons. And they make ones that scan on the head and the temporal area. They're very non-invasive. You do have to read the directions very specifically because they are all a little bit different on how they operate. You don't want any excessive sweat or oils or makeup on the forehead when you're going to do that. That would be a good way to get a temperature. If that's what you had, it's very convenient. Or it's in panic in the ear. All right, so moving on from the temperature. The next thing we're going to do, Lacey, is to get your pulse, and I've already asked you about the nicotine and the activity, and I know that's good. You're calm. The way we're going to usually use the radial pulse unless otherwise indicated. Another reason you might not choose the radial pulse would be if their heart rate's irregular, you're going to want to do a full minute of the radial, but more so than that, you're going to want to do an apical pulse if it's irregular, if it's real fast, real slow. If it seems like it's really bounding or thready, you're going to want to at least take it for a full minute, and the rest, and you're going to want to do an apical too. Midclavicular line, fifth intercostal space to locate the apex of the heart, and that's where you would auscultate the apical pulse. All right, so Lacey, let's bring your wrist over here like this. The radial pulse is here on the thumb side of the wrist in the anterior position here. And just light palpation with the pads of your tips of your fingers here. It's real easy to feel. Don't, just light palpation. Count it for 30 seconds. If it's regular, we're good. Times it by 2 to get the full minute pulse. And after 30 seconds, we're going to go ahead and collect the respirations. One inspiration and one expiration is a respiration. We don't want to tell the patient we're going to do that, so that's why we're going to sort of take it out of the corner of our eye. All right, let's go ahead and get your pulse lacing. Okay, great. Write this down. Okay, 30 was your pulse, times by 2 is 60, and 9 was your respirations. Everything seemed regular, so no need to do anything further with that. Alright, we're going to go ahead and do your blood pressure next, Lacey. Now I just need to make sure your legs are uncrossed. Good. We're going to have your arm here at heart level, with the palm facing upward. Get this. We have enough room here. Go ahead and rest your arm here. We're going to do a 2-step blood pressure after we make sure the blood pressure cuff is the correct size, so we don't get it too tight, abnormally high reading, too loose, possibly no reading at all. One finger under the cuff, about 1 inch above the antecubital fossa here. We're going to go ahead and the length has to be 80% of the arm circumference and the width 40 to 50. The brachial pulse right here, light palpation on the medial aspect of the antecubital fossa. I can feel it very well, so we'll go ahead and use that. So make sure we're good here with the size. Excellent. Lining up the arrow here with the brachial artery. Alright, everything looks good there. I'm going to go ahead and pump it up first without my stethoscope. I'm going to feel your brachial pulse during that time. When I don't feel it anymore, I'm going to go ahead 30 millimeters of mercury above that, then deflate it. Give you a short rest period, then we'll go ahead and take it regularly, okay? First, when I'm doing it in my ears, the first sound is the systolic I hear, the first heartbeat. The second one is the diastolic. The systolic being the left ventricular contraction, and the diastolic meaning the heart at rest. Alright, let's go ahead and pump this up. Light palpation here at the brachial artery. Okay, good. 110. Just going to note that, although it could differ slightly when I actually get it. Readjust this a little bit. Let's see. Give you a little rest period. Okay. Of course, you don't want to put your thumb over the bell when you're doing this because you can pick up your own heartbeat. You want to make sure that the top of the stethoscope here is oriented in the correct position for either the bell or the diaphragm auscultation. I'm going to go ahead and use the diaphragm. And I'm pointing this in slightly toward when I put it in my ears to make sure that it's in my ears properly and I can hear. Little light tap I always like to do just to make sure that we're good with the orientation right over the brachial artery here. Pump it up to 140. 110/58. Just fantastic. I'm going to try to keep it below the systolic below 120, and the diastolic below 80 in an adult. Okay, Lacey, we're going to go ahead and move on to getting your oxygen level or pulse ox. I'm going to need you to bring your hand up here and lay with the dorsal aspect of your hand facing me. You do have some nail polish on your hands here, which can definitely hinder or obstruct the results. You do have one that I see you remove the nail polish. Great. No hand tremors, and your circulation and your hands are nice and warm. Those things can certainly alter it. If they were having hand tremors, you might just sort of do some light touch and just tell them to relax. That can help. Okay, Lacey, let's put this in here. It'll take a few seconds to get a reading. Place your finger down and keep your hand nice and still. Two numbers on the oxygen machine would be the oxygen level and the pulse. The oxygen level is indicated by the SpO2 at the top. It's usually a little bit bigger than the pulse on the left side. You generally get this on the finger. They do make some pulse ox machines that have special probes at the end where you can do it on the earlobe or the toe. But typically it's done on the finger unless there's some other reason it needs to be done somewhere else. Now there is an art to this, that's for sure. I know her pulse ox isn't 52. There's no signs of that. Her lips aren't blue. She's not feigning, which she would be if it was that low. This happens all the time. Sometimes you have to use different fingers. It's for sort of a skill you learn. Okay, that's not right. There's no signs and symptoms of it being 52. Let me shut it off here and turn it back on. Of course, I can't use any other fingers because all our other fingers has nail polish on it. So go ahead and rest it there for me, Lace. Okay, and we are getting 98 at this time, so that's a little bit more accurate. For an adult, with the adult, it should be between 95 and 100. Older adults, sometimes doctors are okay with it going down to 92 before they begin to worry. So we're good there. And that was on room air, which you always want to specify when you're getting an oxygen level. It's with oxygen or room air. Alright, and finally, Lacey, I'm going to ask you some questions about your pain. Do you have any pain, and if so, tell me a little bit about it, like what happened and where it was that you got into that pain.
My knee, about a day ago, I tripped.
So you tripped in your home about a day ago and bumped your knee. And let me ask you something. When you did bump your knee there, how long did the pain last? Or, did it get any better? Or how long did it last?
About an hour.
About an hour? Okay, let's write that down, 1 hour. A little bit about the pain. Can you tell me when you did that, on a scale of 1 to 10, what was it?
3.
About 3? Okay. And then you said after about an hour it sort of subsided. Okay. Now, is it stabbing, shooting, dull, pain? If you had to describe it in a way, could you?
Dull.
Dull. Okay. Can you tell me a little bit about anything that you might have noticed that you do that sort of flares that pain up or reactivates it or makes it worse?
Exertion.
Exertion. So just using it a lot or maybe putting some weight on it, stuff like that. Okay. Is there anything that you do, not necessarily medication-wise yet, that seems to help it, such as ice, trying to put a little bit more weight on your upper foot, anything like that?
Ice and rest.
Ice, rest. Okay. Do you take any medications for that pain at all?
Tylenol.
Some Tylenol. Okay. And does that pretty much resolve it when you do take the Tylenol? Yeah. Okay. Good. Now, does that pain, when it does flare up, does that seem to hinder your activities of daily living, such as dressing, getting ready for the day, going about your day? Does that? No, not really. Okay, well that's great, fantastic. All right, Lacey, I think we are through here. So it was nice meeting you, and all right, guys.